The gastroenterology program currently covers upper endoscopy, capsule endoscopy, colonoscopy, and site of care. One of the most important initiatives that we're working on in gastroenterology is a colorectal cancer screening program. The colorectal cancer screening program is meant to close gaps for our clients and to get people who are difficult to get screened. We want to get as many patients who are eligible and appropriate for screening to get that screening. So there's a gap there. There's a gap in getting them screened. And then there's a secondary gap here that's extremely important. And that is the gap that occurs when a patient has a positive screening test. So one of the important tests that's used for screening is called a FIT test. Test the stool for the presence of blood. Well, there's a gap in patients who test positive for that test who then have to get a colonoscopy. Not everybody who tests positive gets that colonoscopy. And that patient is at a much higher risk of having colon cancer than someone who was negative. And so you really need to get them to get their colonoscopy. So that's another gap that we'll be looking to close. And our plan is to do this with a navigator system, proactively reaching out to patients. Number one, in the first part, to get them to get that screening. Hey, haven't you gotten that screening yet? And to address reasons why that's not happening, to look at social determinants of health and see how that's impacting why they are or not getting screened. And what can we say or do for them specifically to get that test done? And then for the secondary part, reaching out to them and saying, hey, you've had a positive test, you're in a situation where we really need to get that colonoscopy. What can we do to help you get that colonoscopy done? And so that's our vision for the colorectal cancer screening program.